Assalamu alaikum. Welcome back to Wellness Compass, a medical show that is designed to serve as your personal guide in this very, very intricate world of health and wellness, where our experts provide you with advice that allows you to navigate your own personal health journey with using the advice from our experts, but on your own terms. So today I have a very, very special expert with me who's going to discuss a population that is very commonly underrepresented and underrecognized. I'll let her talk to you about it a little bit more, but first let me introduce you to a very, very distinguished professor, Dr. Suzzanna Javed. Thank you, Dr. Suzzanna, for joining me today. She's
Thank you, Amna, for inviting me.
Of course, it's a pleasure. She's a professor at Long Island University and Suffolk Community College and is a behavior consultant who helps people with disabilities. That's the population that I'm talking about that we don't often recognize around us. I'm sure we come across a lot of people on a daily basis, but for one reason or another, they're not as well represented as we would like them to be. She has a Ph.D. from Columbia University and has over 20 years of experience. She's trained as psychologist. She's trained to administer psychological tests and uses ADOS2 to assess individuals for autism. She's an extremely passionate advocate, and you have to take my word for that because I have seen her do that for people with disabilities and their caregivers. They become part of her. They're family to her, and she works with agencies to improve their outcomes. She's also working towards becoming a certified to help people with substance abuse issues. Again, a huge social issue that sometimes is not dealt with appropriately. And there's definitely a dearth of experts who know how to handle that correctly. And she also works as an authorized broker for individuals with disabilities through the Office for People with Developmental Disabilities. Wow, Susanna, you're doing a lot, carrying a lot of hats. Welcome again. So I just dive in. I just to begin the conversation, I would like us to educate about, I mentioned how this population, people with disabilities, autistic individuals, they are very, do you feel that they are underrepresented and a lot of them go unrecognized and we don't really recognize the fact that they have a certain disability, which if it's worked on appropriately, can be improved on?
Thank you, Amna, for inviting me. I do feel that this population is not represented correctly. And the reason I would say is because I feel that a lot of times we label them that this individual has autism or this individual has intellectual disability. And sometimes we take their personality out of it, or sometimes we, broaden their traits. So it kind of is very, so for other people who are just looking it from outside, I sometimes do feel bad for them, but I do think that empathy is needed. For example, I work with individuals with autism, but that individual just don't have autism. He also might have OCD, ADHD, maybe some psychosis like schizophrenia. So we have to not just treat that disorder that, okay, he has OCD or he has autism. We have to take him as a person. And when I was doing internship at Bellevue Hospital, my supervisor said something that was very interesting. He said, all humans are living documents. So when you deal with any human, you should deal with them that they are like humans and they have individual characteristic. Don't just label them with certain disorders. And that kind of stayed with me because initially I used to say, oh, he has OCD, so there is perseveration, there is obsession, and there is other symptoms. But then once I kind of understood that it's not just the person or just the disorder that I am dealing with, but I am also dealing with a person who is kind of in that whole disorder phenomena, then it's more better for me. And to be honest, just to be frank, and so that I have anxiety. I was going to say autism, I don't have autism, but I do have anxiety, and I'm not very ashamed to accept that I take medication for it. But the reason I tell other people, initially I was very like, oh my God, I'm never going to take medication. But with like, especially when I was completing my PhD, it was like just affecting my life so much. There was so much stress on me that that's when I met with the psychiatrist, and I just requested him to, see what I can, get. So I just feel having anxiety myself and looking at people from that perspective has helped me a lot. And like I said, I don't want to label somebody, this
Mhm.
person has this. And there was another time in Colombia, our one of my professors, he used to say that don't label them. I know you use the word autistic. I don't want to I don't think I'm correcting you, but he used to say it is individual with autism, individual with
I
intellectual
see.
disability.
Oh, yeah,
So he always said that you won't say this person is cancerous. You
right.
would say this person is diagnosed with cancer. So yeah, that's something that I always feel is very important for me, and where I teach students to, and that's when I tell them, because a lot of people around me, they
Hmm.
were like, oh, this person is autistic, this person
Yes.
is this. And I always try to change the terminology, but not with like this, oh, you're wrong, but
Yeah.
just making them understand that this is, we don't want to give them this label because they're more than just their diagnosis.
I know. And Suzanne, I can't uh, even imagine how that changes. Like that, just the way you said it, it changes the whole perspective. Like, for example, you're so totally right. Like, for example, I'm a lung doctor, and I never say this patient, he's an asthmatic, right? We always say that he has asthma. Like, this is some sort of, a disease that we can treat, and that doesn't take away from his
Mhm,
personality, or for him being an individual in a totally normal fashion. But I'm totally guilty of that, that I actually just was probably gave a demonstration when I said autistic. When you're right, it's an individual who carries a diagnosis of autism, or who has autism. So
mhm,
I think that's a great a point to make, that that person, that autism is not that person. It's just, maybe a disorder that he's dealing with and can be dealt with, and he
mhm.
can still go on to be an absolutely normal person. That actually provides a perfect segue for my next question to you, and I'm sure you have plenty of experience with that. How do you feel that individuals with disabilities actually experience bias or stigma in their daily lives? And I think you may have alluded to that a little bit. And but the more important part of my question is that what strategies do you usually employ, or you find that are effective in addressing those issues? Because I think that's what we all need to learn as individuals.
So I definitely feel there is a bias and there is stigma. Especially I have because I work with adults and cognitively more able individuals with autism
Mhm.
or ADHD, and I feel sometimes because they can drive, they can actually work, and they have jobs. So sometimes when I take them to, integrate them in the community, I feel that there is a lot of, they say sometimes inappropriate things, and people like immediately try to correct them. That's when I kind of chime in, and I was like, okay, I understand that that thing really made you feel upset, but I want to let you know that this person needs help and they have diagnosis. So this I have established with the individual already. So I'm not just giving out their diagnosis to everyone.
Right.
I let them know that this is if you need help, we have to tell the other person that if they are kind of getting aggressive or upset with you and they are not able to understand your humor, because sometimes people just feel or individuals feel that if you don't have people who have autism, they don't make eye contact, they are socially not able to, talk to you. But sometimes it's on the other side, or like it's a spectrum. So there are times when they will speak to you, but they will get like lose their boundaries. So it's
Mm.
not just socially not able to communicate, but sometimes they over
Over
communicate,
different. Yeah.
or they will say something like sexual or something inappropriate that people might say, oh God, like
Mhm.
this person needs to understand. So I
Right.
think the biggest thing of with people who are physically disabled or intellectually disabled, and you can like physically see them, I feel there is stigma for them, but I still feel that they don't go through so much of, I would say, they don't go so much of this stigma or bias, because people look at them, and
And
I feel they kind of almost like feel pity for them, which I don't think is the right approach as well. But with the other ones, like with who are cognitively able, I feel they struggle the most because people don't know where they should place them. And that kind of brings me to, and I'm sure a lot of people have watched the movie A Beautiful Mind.
hmm
It is by like the Professor John Nash and his life. And he didn't have intellectual disability. He was very, cognitively able, and he had different theories. I mean, I'm not very into like what theories he had, so I don't know. But the thing is that he had schizophrenia, and he had so which is more mental health side. And so all that thing that kind of overlaps intellectual disability and mental health, that becomes a very gray, because you cannot really deal with that, or you really need to understand the issues before you can, provide strategies.
So basically, what you're saying is that we need to create more awareness around intellectual and cognitive disabilities, and have people understand that there could be limitations involved with that too, and have people become more flexible and generous in their approach towards such individuals, and that's where people like you come in, who are doing the community piece too, the community part too, not just sitting in their clinics and diagnosing people with that, but then trying to integrate that population into the community so they can become productive members of the society and utilize their potential to the fullest.
Mhm.
The other thing I wanted to ask you, and it kind of seems like pretty obvious, but I think people tend to ignore that too, is that do you think that individual with intellectual or developmental disabilities experience added stress or anxiety? And if that's the case, what coping strategies or interventions have you found that support them the most? Because I'm sorry, I was just going to say that I'm sure, all of us, if we look around, we will probably know at least one such person. So, educating us on how to maybe help them better manage their stress or anxiety would definitely be helpful.
So yes, so individuals, how to, they already have their diagnosis, they're already dealing with something, they are already on medication. So some of them are already on medication as well. And then on top of it, sometimes they have an additional stress or an additional frustration. And sometimes people are like, just do deep breathing, just do meditation. And I feel like immediately you cannot just impose them. This
Right.
exercises or meditation needs to be taught before than just in, like if somebody starts telling me, just start breathing. I mean, I always think from my perspective, I
Mhm.
always say that if somebody tells me, Susanna, just start breathing or just stay calm, actually that frustrates me more when people tell
Yes,
me
I know.
start breathing or just it actually
Yeah, you're like,
frustrates.
what do you think I'm doing, right?
Yeah, 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 exactly. I just feel like people need to understand it's not just breathing, or it's not. You need to teach these strategies even before the behavior happens. And if
Yeah.
something is more symptomatic,
Hmm.
not to take away things from them. I have always, you are losing your iPad, like in the moment of this whole behavior you
Yeah.
are losing this activity. You cannot punish their behavior. You cannot punish their behavior in that moment because that frustrates them. That does not make them understand what's going on. And
Hmm.
for that population, they need to process it more. So if your processing time is like 1 minute, I'm not saying
Yeah.
you, but any
Yeah.
if somebody's processing time is a minute, you have to see that other individuals with disability have like more will have more difficulty. So
Hmm.
think from that perspective.
Hmm.
Also give them validation.
Yeah.
I have people who have schizophrenia and they tell me, oh, in Japan, there is, heaven is in Japan, and I'm going to go to Japan when I go to heaven and all that. And I cannot say, no, you're wrong.
Yeah.
This is not correct. So I just validate them. I'm like, okay, that's fine. Because the more you argue with them, the more
Yeah.
you frustrate them, it actually builds up anxiety. So they're already going through their hallucinations and delusions, their irrational ideas, and now you're kind of giving them more to worry about by,
Correct.
arguing with them. So I like, well, for me, I feel, in, if you want to train them to do breathing exercise,
Hmm.
if you want to do like meditation, if you
Hmm.
want to work on them about their perseverations, because some of them, I want
Hmm.
an iPad, I want
Hmm.
McDonald's. I want McDonald's. I want McDonald's. Didn't we just talk about that? Yeah, we are going to get McDonald's in an hour. So
Yeah.
kind of like that's frustrating. So you have to understand that you can say, oh, you can check with me in 5 minutes and then
Hmm.
10 minutes. So you build up their time rather than, kind of, we talked about it already. And I
Yeah.
sometimes when people talk like that, it's really frustrating.
Yeah.
For me, I like seeing it. Yeah.
No, that's very helpful because we're all guilty of that. And, we kind of try to paint everybody with the same brush because we think, okay, it's taking me 30 seconds to understand this. Why are they taking 20 minutes to get the same point across? So it's helpful to understand that, like you said, their processing time is probably going to be much longer than my processing time or your processing time. I don't know. Although I think my processing time is probably pretty close to their processing time at the moment. Having
No,
a
Amna,
two-year-old,
let's not
having
go
a
there. You
two-year-old,
are
my brain is
brilliant.
fried.
You are brilliant, Amna, please.
And so, going on from there, the care provider burden is also is huge. And a
Mhm.
lot of time we ignore that, we undermine that, or we forget about it. It just doesn't cross our mind how the care providers or the immediate family members are dealing with it or what they're going through. So, can you share some experiences of family members or caregivers of individuals with disabilities, and are there any support or help from your professional standpoint for them out there too?
So first of all is that knowing, I mean, I have noticed that a lot of times when I go and do assessments, parents will try to, say, oh, he is at a great reading level. He's reading so well. He knows so many words of like words, and his vocabulary is so good. And at that time, I don't want to say no, that
Yeah,
is one of the, symptoms that, because the biggest thing is like they might be able to read pretty, at a higher fluency level, and their fluency might be good, but they might not be able to comprehend what they're reading.
yeah,
So the comprehension needs to be also. But when I go to parents, I don't say, oh no. So
no,
first of all, same thing, like we have to be very empathetic with parents because they're just trying to figure out
no,
what's wrong
yes,
with their children. Like I go into like schools, and I'm trying to assess them for functional behavior assessments, for developing their behavior intervention plans. And a lot of times the parents, when I'm interviewing them, they would be like, no, it's just in the school, this behavior is, I don't see it. And sometimes culturally, I've seen not just in like our culture from Southeast Asia, but I like a lot of like, other cultures, I've noticed that too. They're like, they need to be a little bit more stern with him or her. They need to,
Definitely.
yeah, be assertive. I think he does not have those behaviors at home because we are very strict or wise. So it is really, you cannot really tell them immediately, like, no, these are the symptoms, these are the behaviors. You have to, learn strategies to deal with them. It's not that you're going to punish them and it will get better. Also, I do parent training as well. And
Mhm.
with parent training too, I feel there is a lot of resistance initially. So I really initially have to become more, close them to understand their perspective. Like if somebody's telling me that he's having this behavior or, and the parents usually say, no, that's more in school. I don't know why he's having that behavior in school. So just to kind of give them a little bit validation, I feel. And then there are a lot of supports and resources out, but I feel like a lot of parents are not aware of it. Like
Yes.
there is OPWDD, they can go in, through front door. If you go PWDD front door, you can submit your application. You can, get services like self-direction, where you can get community rehabilitation, you can get respite hours, which are very helpful for parents. And I just think that there are so many resources out which parents sometimes they don't want it. I have
Yeah.
noticed that if I tell them, they're like, no, no, he's good. I think this autism will be cured in a few years. And I let them, not immediately correct them. No, that's not true. So it's just a lot of empathy in this
Yeah.
field, I think.
Okay. And a lot of times, you know, we as individuals intentionally or sometimes most of the times I feel like unintentionally tend to lack that. We're quick to judge
Mhm.
and or quick to correct. And like you said, I think from both talking about both the parties, the affected individuals and their care providers, most of the times all they're looking for is validation. And that's probably what gets you closer to them more than anything else because, nobody likes to be corrected the first instance you meet them. They'll
Mhm.
be put off immediately. So I think recognition, validation, empathy
Mhm.
are very, very important ways to deal with them. That's great. Coming back to you as professionals, and your field is a very, very difficult one. I can't even imagine myself in it. So you and your colleagues who are in the field of disability services, how do you recognize your own challenges or your biases, and what strategies do you recommend for ongoing self-reflection and growth? Because I feel like it's got to be an extremely, extremely challenging everyday life for you, right? Because you're meeting with different people and there's a huge spectrum of these disorders, and someone's probably here and someone's all the way there, and there are lots of mixes in between. So what's your strategy for self-reflection and growth?
So I really believe in professional development. So I do take a lot of webinars. I also try to go for therapy because when you are in this field, because a lot of people are trying to, uh, you are holding a lot of pain of other people
Yes,
or lot of
yes.
stress of other people in your hand, that there is time that you also are exhausted because it's not just you're dealing with them, you're also dealing with your own personal stuff. So I do go for therapy. I also do professional development webinars, and with this whole diversity and inclusion and everything. Like I had individuals in my classroom and in that I work with, they want me to use like they and them and different pronouns. And initially for me, it was, coming from from my own culture and from the way I grew up, it was really difficult. So I'm not gonna lie, oh, it was just an
Smooth
easy
transition.
journey.
Yeah.
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 I like and initially if you call somebody who want to be called they, them, if I call them he or she and they will get offended, I immediately kind of make them understand as well that it's not something I'm automatically doing. Once you introduce yourself to me and you are asking me to use those, pronouns for you, I will use them. So it's not just an education. You are educating me and I'm educating you. So we are all learning from each other. That's where I always bring back that supervisor in Bellevue Hospital. He said that we all humans are living documents and we are learning from each other. And I
Yeah.
just feel that it's inspiring.
It is. It is. I think that's a great way to, end this discussion, and it's a great takeaway message that we're all living documents. We're constantly evolving, and we have to be, um, more flexible, less judgmental in how we deal with others, because everybody is going through their own journey. You can't just judge a book by its cover. So,
Mhm.
we should work on adjusting our behaviors, and that would definitely help build a better society. And, like I said, this population, individuals with these disorders, intellectual disabilities, are very under-recognized. There is a stigma attached to this whole thing. So we all, as members of the society, need to address that and make them help their maximum potential. Because I feel like if they're not helped, we may lose a very, very important and productive member of the society who may
Mhm.
end up becoming a huge burden to the society
Mhm.
at the end of the day. Susanna, any last words that you'd like to leave us with?
No, thank you so much. I just feel everybody that we are dealing with is always right. In The reason I'm saying it is because I feel like you cannot correct people, you can validate them and then move on and look for strategies that can help you to deal with them and they how they can deal with you, I feel. Thank
Yeah.
you so much, Amna, for
No,
actually
thank you. Thank
asking
you,
me.
Dr. Javed. It was a pleasure talking to you.
Yeah, same.